In this video, we're going to review the application of soft wrist restraints, as well as a brief scenario where the application of restraints would be appropriate. So it's 1400 on the med-surg unit when the husband of your patient, John, the 76-year-old patient that just had a right above the knee amputation, yells with panic down the hall. "Someone help me, my husband just woke up and he's trying to get out of bed. He seems really confused." You run to the room to see that John's sitting on the edge of his bed, preparing to stand. His oxygen cannula is laying on the ground, his indwelling catheter is caught on the opposite side of the bed, and his IV is about to be pulled out. His surgical drain is hanging off the bed. John yells to his husband for help. "Call the cops, these people are poisoning me, get me out of here." You and your staff members attempt to de-escalate John without success. You're unable to complete an assessment or get any vital signs. John continues to yell and refuses to put his oxygen back on because that's how you're poisoning him. After consultation with the doctor and the charge nurse, you conclude that you're going to have to restrain John so that you can complete your vital signs and post-op assessments for his safety. You take a deep breath, gather your staff for help, and prepare to restrain John.
Okay, so now we're going to talk about how to tie a soft wrist restraint. So this is just one example of a soft wrist restraint. There are different kinds, but ultimately they all work pretty much the same. This is kind of like a soft foamy material, and there's a buckle on it. Sometimes they have two little tails and sometimes they only have one, but it doesn't change how you're going to tie your restraint. So what we're going to do is put this around our patient's wrist. We always want to use this little Velcro strap first. We're going to wrap that around our patient. Before we do anything else, we're going to check to make sure that's not too tight. We should be able to fit 2 fingers up underneath there. That way they can still have good perfusion. Once the Velcro is done, then we're going to do this little buckle here. We're going to tighten this buckle down a little bit there. And then again, we're going to check to make sure that's not too tight, okay? We always want to make sure that we're going to put our rail up. That way we can see our bed, and that way we can get behind this rail here. Because if we go over and then this rail comes down like this, then this patient's going to have a lot more slack than what they did with the rail up. Another thing you also always want to remember is where you're tying your restraint. We never ever want to tie a restraint to anything that moves. Because if I tie this restraint to this rail here, and then this rail gets put down because someone doesn't notice that it's tied to the rail, you could accidentally dislocate somebody's wrist doing that. So we always want to make sure we're tying it to the correct spots. Different beds look a little bit different, but ultimately all hospital beds and in all of your hospitals and facilities are going to have places, specific places where you're going to tie restraints. So on this bed, there's actually 6 different places to tie restraints, 3 on each side. So you have one right here. So notice how this is actually connected to the frame here. So you have one here. Sometimes they're a little hidden like this one. This one you kind of have to lift this up and you'll see it there. And then you have another one up top right here, okay? Why do we have 3? Well, it depends on what your patient is doing. If your patient has a fully catheter tube, you're not going to want to tie it down at the end of the bed because then their hand is still right down here. They can still pull that catheter out. If you have a patient that's pulling an NG tube out up at their nose here, you're not going to tie it up here because then they're still going to have plenty of slack to get up to their nose. So I'm going to go ahead and just tie it down at the bottom one here just because I think it's the easiest for you guys to see. So sometimes tying restraints looks really easy. But then when you get to go do it, it's a lot harder than you think it might be. That's fine, but it's just important that we're tying it the right way, just so that if there's emergency, we can always untie our patient to take care of them appropriately. So, slip knots. It always has to be a slip knot, but the way that you think about your slip knot can change. So, here's the first way that we can do it. We're going to take our restraint, both of our little tails, or if it's only one tail, that's what you'll put through. So we're going to put it through the loop there, okay? This way I like to think of like a 4. So I'm going to pull this down with my index finger. See how there's a little 4 right there? Now what I do is I make what I call a little bunny loop. I make my bunny loop right here. I'm going to put it through the 4, hold the bunny loop, and hold the part that's closest to my patient and pull, okay? So notice the patient can pull on this as much as they want and it's not going anywhere, but I still have a quick release pull right here. Pull it in case of emergency, I can unrestrain my patient. Now, if that makes sense to you, do not watch the next part of this video because it will confuse you. But if that didn't make much sense to you, keep watching and see if this way makes more sense. You're gonna start out the same way. Put this through, just like we did in the first one. This one I like to think of it like a U. So I'm gonna take this and I'm gonna wrap it around. Okay, notice that kind of looks like a little bit of a U right there. And what I'm gonna do, see the U? Is I'm gonna make a little loop, but don't pull it all the way through. Hold the loop, hold the part that's closest to the patient, and pull. Same kind of knot, we can still, the patient can't get that knot undone, but we can in case of emergency to pull it, okay?